Burjeel Reem, one of the leading day surgery centers in the Middle East. Let me introduce the most and the best way to connect with your patients, actually by having a day or of 24 hours pianist to put our patients connected to the art of healing. Since 2017, Burjeel had more than 10,000 a day surgery. 5,000 of them were over only on 2021, with the modern techniques and with all the benefits to achieve excellence during this year. Of course, excellence in both inventive and minimal inventive day surgery on the same year and on the different years. Now I would love to introduce Dr. So can they come? You didn't come yet? Okay, I'm going there. My pleasure, Mohammed Al Jabri. Sunil or Sanil?
Sunil.
Sunil,
Yeah.
it's my pleasure. So I would love to introduce, of course, our guest of honor, Dr. Muhannad Diab, medical oncology consultant, along with Dr. John Sunil, the regional CEO of Burjeel, to cut the ribbon to start our first oncology department across VPS group. Please. Please be seated. Ladies and gentlemen, Mr. John. All right. So I would love to start with thanking Dr. Muhannad and Mr. John for the tour happened upstairs. Mainly it shows how Burjeel Reem is giving a lot of effort for our cancer. Okay, for our cancer patients. So thank you very much for having this first oncology here. And now we want to launch the LED cube. So I would call Mr. Aaron Lobo to call all of our guests, Dr. Muhannad Kan'an Al-Breki and Mr. John. Put your hand. You can put your hand and then you can start the launching.
That changed my life. The day I got diagnosed with cancer. I was angry, I was anxious. Why me? Why has this happened to me? How far will life take me? The road you have to travel then becomes unknown, far and bleak when the most difficult part begins. The search for the right care partner. Not to be taken away from everything I've built and to be close is all I seek. They say hope is where your home is. Hope is where your near and dear ones are here to ease. And now, with the Oncology Care Center at Burjeel Reem, everything just feels closer. The care, the comfort, the attention, everything just feels closer. The fear of the unknown is no more. Nothing looks strange. Nothing now scares me. Because a new me is yet to evolve, closer to my home, closer to my heart. Closer, I get to live another new life. Close the care gap with Burjeel Reem.
Mic is on. What a touchy video. And that's actually a great campaign to start a nice message and a good hope for our cancer patients. I would love to call our keynote speaker, Dr. Muhannad Diab. Please come on the stage. Dr. Muhannad Diab is the medical oncology consultant. Please tell us your opening speech.
Thank you. Thank you. Good afternoon, everybody. I'm really thankful for all of you to come today to join us in this nice event. What I would like to say here is the following. Every second, there are 64 new cancer cases in the world is diagnosed. Every second, there are 64 new cases. How it was calculated? According to the World Health Organization, there are 20 million new cancer cases diagnosed every year. So if you keep dividing this number by 12, by 30, by 24, by 60, so then you will be getting it per second. It is 64 new cancer case every second in the world. In UAE, we have around 4,100 new cancer case per year. If we divide this number, again the same way like per day, we will be finding that we have in UAE a new cancer case every 2 hours. Every 2 hours we do have a new cancer case. Definitely cancer, when it is diagnosed, it touches like everybody in the family, everybody in the friends of the patient, everybody in touch with the patient. And what is interesting here and very important to mention that cancer does not recognize between races, religions, sex, ages. It comes wherever, whenever, and for everybody. That's why we are in need to put all of us, our efforts in fighting this disease. What we are in need to do, we are in need to prevent cancer. We do have nowadays some genetic tests which can tell us who will be getting cancer and almost when. And we can prevent it and we can keep our patients, like our people, safe from this disease. Even if this diagnosis happens, we put great efforts in order to make the quality of life better and better for those who are diagnosed. What do? We have, as an example, after some minutes, we are going to show you one of the nice inventions. I'm very proud to say that this invention has been created by my teacher. He is a Professor Bo Nodenhuld. He is the one who put this idea in 1994 in Sweden. He created this idea of the cool cap machine. He is the first person who tested it, and he called it Digni. He gave it the name of his daughter, Digni. And then he created this cool cap machine. Definitely, like, I will not break the news, but I will just give a small brief about it. It decreases the temperature of the scalp into -5 degrees below Celsius. So the blood vessels will shrink. It won't allow to the chemotherapy to reach to the hair. So by this way, we prevent hair loss, and it works in 75% of cases. We do have many ladies, many women who are getting a treatment with chemotherapy and they don't lose even one hair from their head. So the phenotype of a patient without hair has really gone. It is in our past now. This is what we mean when we talk about quality of life for patient. When we care about the psychology of the patient, we consider every patient as a part of the family, and this is our habit here. This is our habit, and that's why we are successful and we are more close to our patients. I would not take so long time, but I would like to say that we should break the silence when in here, like in UAE and in many countries, when we talk about cancer, we say that disease. We do not call it. But what we need to know, what we need to do, we have to familiarize the society with calling the disease by its name. This is one step how we are going to fight the disease. We are not ashamed of it. We should talk about it, and that's it. Thank you very much. I appreciate your coming. I will leave the mic for my colleague.
Thank you, Doctor. Thank you very much. And now we have our panel discussion. And the topic is actually very interesting. It's courage, caution. And we have warriors with us, we have doctors with us, we have everyone to talk and to discuss this panel. So I would love to introduce our panelists. We'll start with Ms. Lana Kati, founder of UAE Moms Group, health ambassador, certified trainer, personal development coach with the focus of women empowerment. Ms. Samah Al-Ula from Red Crescent, Hilal Al-Ahmar. Dr. Mariam Al-Shamsi from ADNOC Group. She is occupational medical governance. And of course, our fighter, our cancer fighter, Dr. Sharon. Assistant Professor, Skyline University College in Sharjah. It's our pleasure, Doctor, to have you.
Okay, thank you.
Thank you. Okay, so let us start with our panelists. First of all, thank you very much for coming and attending such a very, I would say, a humanitarian event to start a hope for our cancer patients. So thank you very much. I will start with Miss Lana. And if you would love to, do you want me to ask you in Arabic or in English? What do you prefer?
Either language, whatever.
All right, okay.
What suits everyone. I think English is dominating.
So what do you
today.
prefer, Arabic or English?
Let's have some hand raise, maybe.
English?
Yeah.
Okay, so English. Now you are representing thousands of women across UAE. And of course, detecting the cancer early is always the I would say, the protocol number one to start fighting cancer. So where do you take, or where do you think women should take their first step on this?
Well, as a representative of the community, especially when it comes to mothers, because usually we think of cancer awareness, we want the early detection. With early detection, we are guaranteeing more survival rate. For the past many years, when we are doing cancer awareness, we're always focused, as Dr. Diab said, on how many cancer cases are being detected every minute, every second. But we do not do a lot of coverage. We do not do a lot of coverage of how much is the, I wouldn't say survival rate, but what's the rate and what's the number of recovery? We don't talk about it too much. And that's where we want to change awareness to go in that direction so women are more empowered. For the past at least 10 years, there's been a lot of awareness for early detection and hopefully in the future prevention. But now we want to do a positive reinforcement in the community and encourage them that this is not anymore a shameful disease. This is not anymore, as Dr. Diab said, a disease that will, end your life or kill you, but there is a lot of recovery rate. And this is what we want to spread within the community, the awareness of recovery.
Sure. It's a really great message. It's a warning, and it's as you mentioned, it's not a shame, or it's not a disease which one should be ashamed of. It's a part of life which you need to start fighting it and getting rid of it, inshallah. Ula, or Miss Ula. Do you want me to say it in Arabic or English? What do you prefer?
خلينا عربي.
عربي, okay. الهلال الأحمر الإماراتي يعني له بصمة في كل مكان. I'm going to translate by the way. له بصمة في كل مكان. في كثير من المجالات، في أشياء كثيرة قدرتوا كمنظمة أسميها كهيئة شلتوا كثير أعباء من الناس. بما يخص الكانسر، بما يخص السرطان، كيف الهلال الأحمر دعم هذا المشروع؟
دعمنا مشروع مرضى السرطان خاصة مع اتفاقية VBS برجيل، نغطي كل حالات مرضى السرطان، يعني ما نستثني أي حالة، بالذات مرضى السرطان لهم يعني مساعدة عندنا مميزة من خلال يا إما أن نحن نغطي بطاقة الضمان اللي هي بتغطي شامل تكاليف العلاج الكيماوي على مدار السنة، أو نحن نغطي بشكل عام العلاج الكيماوي. وعندنا طبعا تكاليف، عندك تكاليف الأشعة بيت سكان، عندك تكاليف العلاج الإشعاعي، أدوية السرطان بشكل عام. نحن لنا بصمة طبعا بالذات لهالمرضى، يعني مرضى السرطان بشكل عام. يعني
هل بعد اللي هو الفحوصات قبل الواحد يعرف انه عنده مرض السرطان، الله يبعد عنكم الشر، هل بعد انتم لكم فيها مثلا دخلتوا في اكثر من كامبين، دخلتوا في امور كنتوا السبب فيها، يعني ان انتم استعديتوا كهلال الاحمر انكم تدعمون الناس ان يروحون يفحصون او يسوون شيء؟
طبعا عندنا موظفين
نعم.
باتفاقية مع VBS متواجدين في فروع برجيل، يستقبلون طلبات المرضى، خاصة اللي حالاتهم أحيانا تكون صعبة. بالتالي التقارير الطبية هاي توصلنا نحن لمراكز الهلال الأحمر، ومن خلالها نقيم التقرير الطبي من خلال الرأي الطبي واللجنة الطبية، ومن ثم توثيق المبلغ، نشوف إجمالي المبلغ على حسب تقرير الطبيب أو خطة علاج المريض، ونساعده كل ما نقدر يعني.
جميل. طبعا الأحمر الواحد يعني ما يقدر يقول أي شيء، لأنه ما شاء الله أنتم فارضين أنفسكم في هذا المكان. طبعا دكتورة مريم، حياك الله. just to make sure one.
الله يحييك.
الله يطول عمرك. الدكتورة مريم، مرض الكانسر بالنسبة للناس خلينا نقول بالنسبة لهم هي عبارة عن صدمة، خلينا نقول صدمة سواء أسرية، عاطفية، صحية، صدمة، ونبى نطلع الناس خارج هذا الفكرة أو خارج هذا الإطار. كيف أو شو هي بتكون رسالتك اليوم لهذا للمجتمع، أنه والله خذوا من المرض هذا كفرصة لحياة جديدة، لشيء أفضل؟ فأود أن أسمع منك، يعني أنا سمعت أن أنت لك باع كبير في هذا المجال. تفضلي.
أول شيء طبعا أشكركم على هذه الدعوة، وأبارك لكم هذه الخطوة يعني رائعة صراحة، واللي تضيف كثير لمجتمع الإمارات، كوني سيتيزن يعني من دولة الإمارات، وأيضا كطبيب معالج يعني لحالات مشابهة.
نعم.
طبعا احنا دائما نتكلم عن الوقاية، هي الوقاية خير من قنطار علاج.
صحيح.
فنحن دائما نقول prevention prevention prevention. طبعا على مستوى الأفراد احنا نقول حاولوا تستفيدون من برامج التوعية الموجودة. مثلا احنا عندنا مثلا برامج ثقة، مثلا عندهم برنامج وقاية.
نعم.
برنامج وقاية يشمل كثير من الفحوصات اللي هي نسميها السكرينينج للأمراض السرطانية على حسب طبعا الفئات العمرية. فمثلا هذه فرصة صراحة لكل الناس، وطبعا الحمد لله يعني أعتقد معظم المنشآت الطبية تذكر المرضى بضرورة هذا الشيء يعني، وحتى بعض في القطاع الخاص أيضا عرفنا بعد أن في إكسترا يعني في فحوصات إضافية حتى تضاف منهم كإكسترا مايل في هذا المجال.
جميل.
عرفت لي كيف؟ فإحنا دائما يعني ننصح الجميع بالاستفادة القصوى من البرامج هذه اللي هي البرامج الوقائية، أو نقول إحنا السكرينينج. بعدين التثقيف، أن الإنسان يثقف نفسه، يحاول يعرف يعني طبعا منها يعني الحياة الصحية السليمة، العادات الصحية فيما يتعلق بالتدخين، بطبيعة الأكل، بالممارسة الرياضة،
اللايف ستايل بصفة عامة.
اللايف ستايل موديفيكيشن. هذه طبعا واحدة من الأشياء الأساسية يعني لما تنصح المريض أو تتكلم مع المجتمع يعني في برامج التوعية، دائما نركز على هذه الجزئية.
جميل جدا.
نعم.
يعني الواحد ما يعرف شو يقول صراحة، لأن فعلا هي أنت بديت الكلام بأن قنطار وقاية خير من قنطار علاج، أو
درهم وقاية خير من قنطار علاج.
بالضبط.
نعم.
فالواحد دائما يتجه للوقاية قبل لا يدخل في المعمعة أو الأشياء اللي هي تعتبر للناس مخيفة. شكرا. To our warrior, Dr. Sharon. Actually, you are a cancer survivor. I would love to applaud you. Honestly, I cannot put my words. I have my script written, but I would love to ask you this question personally. When did you start this journey? At the very beginning. What happened? Of course, I'm going to get you my mic. Don't worry about it. What happened, and what was the cause, and how you, I would say, you won this? You survived, yes. Pledgerly, you survived. Please.
Thank you so much.
You're welcome.
And before I'm going to tell my story, of course, I will just going to share what's the most significant event, I may say, that basically leads me to combat and survive 8 years now of cancer is, first things first, is people usually use the word courage, okay? But courage, when you have to look into it, it is a very, very powerful word.
Indeed.
It is.
Yeah.
But when a person is being tested of such serious illnesses, a lot of people immediately forget that they have already the courage within them.
Yeah, that's right.
So in my case, actually, I will say that I'm going to be guilty at the same time.
Guilty.
Yes, guilty, honestly. It is simply because many of us tend to just ignore what health is all about. We failed to look into the family tree, okay, of what are really the existing diseases within the family. So in my case, that basically happens until in 2015, boom, stage 3 breast cancer immediately.
Oh, stage 3.
Yes,
Okay.
yes. And my journey was not easy, okay? But I can say having 3 different opinions basically helped me to decide which of the healthcare should I go, which I also have trusted a lot, that I put my life in the hands of Dr. Diab. Yes, okay?
Legend.
Where I can say that healing is a two-way process, all right? It is a relationship between the patient and your doctor at the same time.
That's correct.
I'm an academician, and we always says in economics, a Pareto efficiency, which is 70-30%, okay? But I came up with my own theory that basically says 50-50%, you know? Healing is like a dance, a tango dance that it takes 2 people to dance perfectly. So healing should be 50% also a job, a responsibility from the patient and also from the doctor as well.
That's correct.
You have to be responsible enough as a patient. It does not necessarily mean, yes, we do have expert doctors. Our family, we are being surrounded with love and support and friends as well, all right? But if you as a patient, okay, doesn't want to help yourself as well, the rest cannot do anything about it.
Totally right. Starts from
So you
yourself.
have to be also responsible, okay, that you have to do your share. And I remember one time Dr. Diab told me, Sharon, please, have that Mr. Google little bit, you know, because you seem to be reading a lot, but I read and I confirm. When he told me that, yes, you're actually going to start your chemotherapy, all right, what I did is I read, do a lot of social media and YouTube
Your
research,
Yeah.
okay? And by the time I went into my journey for the chemotherapy, though it was really, really difficult, but it did help.
Sure.
It was really, really help. So aside from the doctor and the patient relationship, okay, I may basically say it has more on also on the attitude.
Attitude.
Yes, okay? Because once you will be told that, my dear, it is confirmed this stage 3 breast cancer that you have, a lot of people will tend to deny it. And that will not help in healing. Courage means acceptance. You need to accept on what is really the reality. And never question why. Because there is a reason and there is a purpose as to cancer is actually given to you by our Creator. He has a message for that. So for me, in my experience, I did not ask question. When he told me, Dr. Diab told me, yes, Sharon, it's really stage 3 breast cancer. I did not ask any question, but I just immediately says, I'm going to surrender everything to you and you will heal me.
And he did it.
And
You
I
both
did it. And now I'm here talking to everyone, 8
Mashallah.
years survivor.
Pleasure.
Yes. My youngest son is here. He's very shy. Okay. Yes.
Okay.
And that's the most important thing, the doctor and the patient relationship. Where the moment you can feel it as a patient, even if you have not met your doctors yet. The moment you step in the building of the hospital, there is a intuition of a feeling that this is like a family. The hospital is like my home, you
Yeah.
know? So the moment you feel that kind of emotions within you, that is already a hint for you that yes, you are in the right hospital. And when you actually going to meet your doctors, specifically Dr. Diab, okay, you have to trust. Because for me, Dr. Diab and the other medical practitioners are actually gift from our Creator.
That's really nice. And it's very touchy
They're
message.
gift. And they are there to help us.
That's correct.
Thank you so much, Doctor.
I would love to hear from Dr. Diab. We have mentioned him a lot, and he needs to say something now.
Well, yeah, definitely. Again, like whenever we diagnose such a disease, we have to directly build bridges with our patients, bridges of trust, bridges of coolness, because we have to cool down our patients, we have to cool down their families, advise them like how to cross over this difficult time. This is how we usually advise our patients to pass it. We have direct contact with our patients also. Sharon knows, like she texts me and I text her. I send her also regularly the updates, what we have, and she sends me also a lot of updates. Yeah, like this is the relation between the doctor and the patient. I do believe it should not be like there must not be a barrier. She feels free and to communicate with me anytime, and it happens anytime really. And we talk about many things. I am very happy to vanish her fears at once once it appears. I believe, you know, since my childhood I wanted to be a doctor. So that's why I love my job, I like what I do, and I feel very proud when a patient says that I'm fine now. Thank you.
Shukran, Doctor. Thank you very much. That's very nice. It's really nice. Thank you very much, panelists. And a really pleasure to hear all of these nice messages, success stories. And please be seated and let me call Dr. Fadi to... Dr. Fadi? Dr. Fadi around? Dr. Fadi, salam alaikum. We need you to praise our panelists, please. تعطيهم جوائز.
يلا جاهزين.
Let's go. Please. So of course we'll start تفضل دكتور. بس علا سماح ولا take pictures. course to our cancer fighter, Dr. Sean, thank you. Group photo. Go with them. Thank you. شكرا جزيلا. تفضلوا أماكنكم. Please be seated. We are not done yet. You guys in rush. Okay, so now is the unveiling of the hope. I would say for not losing hair. This is the main message I would say. And I would love to call Dr. Sharon to unveil the scalp cooling machine. Doctor, please join. Please. Yeah.
I have that experience.
That's fine. She can support. 1 second, yeah, just.
Losing hair is one of the most noticeable and feared side effects of cancer treatment.
Many patients, they do refuse to take their chemotherapy treatment due to the fear of losing their hair.
But this is about to change. Thanks to the clinically proven revolutionary treatment known as cold cap therapy. Cold cap or scalp cooling is a simple treatment that can prevent hair loss caused by certain chemotherapy drugs and can result in high level of retention or completely preserves the hair. So, how does scalp cooling or cold cap therapy work? Cold cap works by reducing the temperature of the scalp by a few degrees immediately before, during, and after the chemotherapy infusion. This, in turn, reduces the blood flow that carries chemotherapeutic drug to the hair follicles, thus preventing or minimizing the hair loss. The patient wears a comfortable cap that transfers the cooling agent to the scalp. Cooling is done across 2 sessions, about 30 minutes pre-infusion and 90 minutes post-infusion, while patients can spend time reading their favorite book.
It's simple, easy, and the coolest way in fighting cancer disease.
Feel the freedom, feel the hope. To know more about the cold cap treatment, meet Burjeel Reem Oncology team.
Nice. I would love to translate. I would give just a quick brief in Arabic about this machine. تسمحوا لي بتكلم عن هذا الماشين بطريقة سريعة جدا. الماشين هذا هو عبارة عن أنا سميته يوم عرفوني عليه لأول مرة سميته بالأمل. الأمل ناس تخاف تاخذ الكيموثيرابي أو تاخذ الكيماوي خوفا من تساقط الشعر، فهذا يعطيهم الأمل بالطريقة اللي هي موجودة. طبعا أنا ما بتكلم عنها تقنيا، في ناس يعني خبراء موجودين، ولكن هي عبارة عن أمل أن الشعر ما يطيح بطريقة أو بتكنولوجي متطورة وجديدة. فأحيي صراحة برجيل ريم على هذا الشيء، وطبعا الدكتور على وجود هذا الماشين عندنا هنا. شكرا لكم. احنا تكلمنا عن الناس اللي بياخذون الكيموثيرابي they shouldn't lose their hair. لازم ما يخسرون شعرهم بهذا المشين. بس شو بخصوص الناس اللي خسرت شعرها؟ فاحنا او في برجيل, and I would love to say it now in English and in both in Arabic because it's for everyone now. There is something called here a hair donation. So mainly we have a volunteer here today to donate her hair. She will be the first one. However, they have a full place there upstairs. Whoever wants to donate their hair to give other hope for people who already lost their hair because of being through the cancer treatment process. Let me call, excuse my English. It's Femi Nova. She's around, Femi Nova. And the hairstylist from Viola Beauty Salon. Femi Nova, she's our first volunteer today. Thank you very much. Before doing this process, are you sure of what you are doing?
Yeah, sure. Yes, I'm very sure.
100%?
100%.
That's great. That's really brave decision. Please.
Imagine to wake up one day and notice you are losing hair. Losing hair can be the most uneasy experience of cancer treatment, but donating some of your locks can unlock smiles for many. Participate in the Burjeel Reem hair donation drive and donate your hair for the cancer patients. Register now. To know more, visit www.burjeeldaysurgery.com.
Wow, wow. It's more than 30 centimeters it would be. You are really brave. Great applause. Thank you very much. That's a really brave decision, and I need to ask you for this. Please come on stage. First of all, thank you. Thank you very much. I have a question that came to my mind. What is the main motive makes you do this today?
Well, I actually have, I was blessed with the long hair, and I would like to share it by donating it to others.
That's really nice. Sharing her hair. It's first time to hear about it. That's very nice. Thank you very much. Thank you very much. That's really nice. Ladies and gentlemen, now we went, excuse me. So they were just confirming that you guys, your food is set there in the conference room. So once I finalized, you can go all the way. And doctor, you can support him for sure. Thank you. So thank you very much, ladies and gentlemen, for being here today. Thanks to Dr. Diab for this initiative. This is Muhannad Diab, of course, for this initiative. This is a really great opportunity for me today to be part of this nice journey where it starts here in Burjeel Reem, and I would say that here where the gap is being closed or coming closer. Thank you very much, ladies and gentlemen. Now you can head to conference room.